Electroshock therapy, now commonly called electroconvulsive therapy, is a method that can be used by doctors to treat depression and has failed to be successful with treating any other mental illness. The procedure for electroconvulsive therapy, ECT for short, involves an electrical current being pushed through the brain in order to trigger a seizure in hopes that symptoms of mental illness, such as depression, would be cured. ECT is rarely used to treat any mental illness in modern society. ECT is only used when other medications to treat depression have failed. A patient is too old to cope with the side effects of medication, or if a patient prefers ECT to other methods of treatment, such as medications. No one is entirely sure how ECT works, although there are several scientific theories behind how the therapy works. According to the book Electro Boy by Andy Berman, three existing theories are the neurotransmitter theory, the neuroendocrine theory, and the brain damage theory. The neurotransmitter theory is that, similar to antidepressants, the shock alters the way the brain receptors receive mood-related chemical compounds like serotonin and dopamine. The second theory, the neuroendocrine theory, suggests that when the body has the epileptic fit, it may cause hypothalamus, a region of the brain that controls the nervous system, to release chemicals which cause change throughout the body, potentially affecting mood. The third theory is the theory of a famous psychiatrist, Peter Breggin, who suggests the shock causes brain damage, therefore causing the patient to have memory loss and disorientation, and therefore temporarily believing that their depression has been cured. ECT use dates back to the 1930s, when it was used to treat a variety of mental disorders. It was later discovered that the shock therapy is unsuccessful in treating most mental disorders, and can only be used in small dosages to treat depression. Over time, ECT has become a much safer method of therapy, as treatment delivery methods have improved significantly. There are definitely risks to ECT, as there are with most treatments that involve the use of anesthesia, although these safety risks have rarely decreased over time. Although despite this, the treatment has been banned in Italy, the country of origin of the therapy, based on safety regulations. With modern-day treatment, I believe that the therapy is morally and ethically justifiable as a form of treatment if the patient requests its use. The side effects are usually not severe, and the patient is not at high risk of death when undergoing the therapy. Although on the other hand, it does not seem morally and ethically justifiable for an electric shock to be sent through the mind of a patient without scientific evidence that the treatment works. Despite the fact that, according to the American Psychiatric Association, electroconvulsive therapy is successful in treating depression 80% of the time, I still do not believe it is a viable method of treatment. Although this number is considerably higher compared to the 50 to 60% rate amongst antidepressant medication, I believe there is not enough scientific evidence for ECT to be a viable treatment for depression. There is no definite evidence that ECT is a successful treatment for depression, and therefore it is not viable. There are as well both reasons for why it is and why it is not a morally and ethically justifiable therapy. Currently, ECT is only used for those who request the therapy or have had no success at other methods of treatment for depression, or side effects of an antidepressant are too extreme for the patient. I believe ECT should remain a method of treatment only used in these scenarios until it is scientifically proven exactly how the therapy works.